Good morning. My name is Mulenga Victor from Zambia Helper Society. I'm a clinic officer. I've been working with the virtual doctors Zambia from 2018 October, and I've worked with virtual doctors. I've gotten a lot of experience from them, working with them, and I've improved both in practices and also in patient care management. Virtual doctors has helped me a lot as a clinic officer, because you understand that there are cases that when the patient comes, they present with critical cases that as a clinical officer you cannot manage, even though it does not require equipment. It just require medication, but because the case is a bit difficult, you fail to manage and you'd want to refer the case to the hospital. And in most cases, find that the patients that we are having, especially here, they walk for a long from very far places. They just walk long distances, and you will realize that the patient is tired and they come. Maybe they're just using a bicycle, so you'd want to refer the patient if there is no consultation. So now Zambia virtual doctors, they have come in place to help us so that we can manage these clients that are coming from very far if it does not require equipment. So they help us to provide diagnosis depending on the complaints that you present to them, as the patient is telling you, or the patient will complain, and then you send the complaints on virtual doctors, and the virtual doctors will respond with a diagnosis. When they give you diagnosis, they will also advise you on how you go about management. It requires lab. They'll advise you on which types of labs you are going to do on that patient, and if those labs they come out, and what you are going to do next following the results that will come out of from the labs. And then from there they'll give you the treatment guidelines, so you learn from them. So the virtual doctors, they provide also, as I said, advice and also correct decision making for the patients. Sometimes you can make a wrong decision, but the doctors will come and help and also provide the correct decision for the patients. What you're going to give, or you're going to refer, they will advise you. And apart from that, also the virtual doctors has helped us a lot, because we are able to learn new information from them, things that we did not know, what we did not understand. They'll be able to provide information. So despite sending the patients for the benefit of the patient, you also benefit from learning. They'll send you the information, then you'll be able to learn. So we learn day by day by what we consult from them. When they send you information, then you'll be able to know things that you did not know, or things that you did not even understand. At least you'll begin to understand. So you develop capacity building through virtual doctors. And sometimes you can even error. You're going to know this by when you send a case to them which you've already treated. They'll be able to tell you that no, the treatment that you have given is insufficient, or maybe it is too much, or maybe it's a wrong treatment. They will give you another guideline, so you know that so this was an error, then it has been corrected. So they'll give you another type of regime that are going to provide for the patient. Basically, virtual doctors is the best, and we are enjoying being part of virtual doctors. People from UK, doctors from UK, from Zambia, and from all over the world that are involved in virtual doctors. We appreciate so much for the efforts that you are doing voluntarily for the land of Zambia and other nations. May God bless you.